Today guys, on this video I want us to learn 12 different things that we need to do when we are trying for a baby or when we are trying to conceive. And these are things that we can do before pregnancy so as to make a difference to the health of our pregnancy and also to the health of our baby. You know, your health before pregnancy will affect the lifelong of your baby, you know. And by following the below things that we are going to discuss here, we can be able to improve on our fertilities, to improve on our fertility. We can be able to protect our baby's future, and we can also bring down the risks of or problems in the pregnancy. Once we start trying for a baby, we need to stop contraceptives first. You know, most of the ladies are on contraceptives, and if you are planning to get pregnant, then you need to stop the contraceptives, and this should come some months before trying to get pregnant. So when we are trying for a baby, making these changes sooner than later will give you peace of mind, because you will know that you are pregnant, your pregnancy is safe. And then a question comes, are you ready to conceive? This is always the first question that comes to the person who is looking for a baby. And by trying all these things that we are going to discuss on this video, we will be able to make our pregnancy and also our baby health. So, first thing that we need to do before we start or before we try for a baby, it is we need to stop smoking. This is purely for the people who smoke. Smoking affects the fertility and all the ability to get pregnant. That is in both men and women. So if you know that you are a smoker, whether you are a man or whether you are a lady, you need first to stop smoking. And so during pregnancy, smoking is the biggest risk factor for serious complications in pregnancy, and that you can change, you know. So if you are there and you're planning to get pregnant and you are a smoker, the first thing that you need to do is to quit smoking as soon as now. The second thing that we need to do if we are trying for a baby, it is to start taking folic acid. Folic acid needs to build up in your body to provide maximum protection for your baby against some of the defects that can affect the baby. For those who have become pregnant, you know, whenever you go for a clinic, the first thing that you're given by the doctors is the folic acid. You know, many women conceive within 1 month of trying so. And so it is very ideal to start taking the folic acid 2 months before you stop contraceptives, or 2 months or even more months before you start now trying for a baby. It is always good that if you have plans to conceive, it is always good to start folic acid as soon as now. The third thing that you need to do is to eat well-balanced diet. You can improve your fertility by eating a well-balanced diet. And these foods include things like whole grain, unsaturated fat foods, and also vegetables, and also some proteins. And you know, your diet before and during pregnancy will also affect your baby's development in the womb and also their health in future. So eating a well-balanced diet is very much recommended for a person who is looking for a baby, because this will also boost the fertility. The fourth thing that we need to do is to reduce the caffeine intake. Some of the ladies and even men do take a lot of caffeine, and if you know that you consume too much of it then and you want to get pregnant, then you need to reduce the amount. And remember, caffeine can increase the chances of miscarriage. Too much of caffeine in pregnancy has also been shown to be harmful to the development of the baby, and if you are planning to conceive, you and your partner should consider limiting the caffeine intake to as little as 200 milligrams per day. The other thing that you need to consider when you're trying to get a baby, it is your weight. So if you're planning to have a baby, you should not be overweight, and at the same time, you are not supposed to be underweight. And so before you start this process, you need to know what is your BMI, that is the body mass index. It should not be over 30 and it should not go as below as 18.5. As you know, the recommended is between 18.5 and 30, so you should just be in within, because this will reduce the complications that can come over with pregnancy. So if you are overweight or if you are underweight, you need to work on your weight and get the recommended weight before you get pregnant. The other thing that you need to consider is to stay active. Do regular exercises before and after conceiving. This will help your fertility as well as benefiting your pregnancy and your baby in the long term. Women who are more active are likely to have children who are physically active too. And remember, the more you are active, especially after conceiving, the more it will be easier for you during delivery. Don't conceive and continue sleeping. Make sure you do some exercises, and of course you should not strain. Remember, if you do a lot of exercises, can cause your pregnancy. It can cause some miscarriages, and so you're supposed to do just moderate exercises that cannot affect your pregnancy. So if you're planning to get pregnant, make sure that you stay active, do a lot of exercises. Don't just lie there and wait to get pregnant. Or after conceiving, you need to stay active, and this will make even things easier for you. It will also reduce the complications with your pregnancy, and during delivery things will be more easier. The seventh thing that you need to know, that you should stop drinking alcohol. Alcohol has become a daily thing for especially ladies now. Most of the ladies, a big percentage of ladies are taking alcohol. And excessive alcohol drinking of alcohol is harmful to our bodies, and even the manufacturer says so. So if you know that you're one of the people who take a lot of alcohol and you're planning to conceive, then you need to stop taking alcohol. You know, alcohol can also affect the fertility in both men and women. And also drinking alcohol during pregnancy increases the risks of complications, especially this time. You know, during this first trimester, it is when the mind of the baby is being developed. And that is why we are recommended strictly not to take any small amount of alcohol, because this can affect the mind of the baby. And at the end of the day, you find yourself delivering a baby who has no complete mind. So it is good for you to know that if you're planning to conceive, or if you've already conceived, you should stop taking alcohol completely. The other thing that we need to do is to have a cervical screening test. If you are aged between 25 to 49 years, you know that you should have cervical screening every 3 years. And it is the best to get tested before, it is good to get tested before you get pregnant. So if you're planning to get pregnant, or if you're looking for a baby, please just have your cervical tested, let it be screened, and so as to be sure that you have no complications, and to make sure that your health is good. The other thing that you need to consider is to have sexual health checkup. In case you have a reason to believe that you have an STI, it is always good to be tested before conceiving. This is especially if you feel that your partner is not trustworthy enough, and if you feel that there is a reason for you to be tested an STI, it is always very important to be tested, because you need to have it treated if you have any problem. Remember, once you get pregnant, it becomes so difficult for these things to be, or for these diseases, for some of these diseases to be treated, and they might also affect the health of the kid. So if you're planning to get or rather if you're planning to conceive and you feel that there is need to be tested, then it is always going to go see your doctor, let you be tested for the STIs. The other thing that you need to do is do not take non-prescribed drugs. Whenever you have a problem, don't run over the counter, buy the medicines and take without doctor's prescriptions. Any drug that you're taking should be prescribed by the doctor. And the other thing that you need to consider before you conceive, it is always good to talk to your doctor about your existing conditions. There are people who have existing conditions. When I talk of existing conditions, I talk of things like diabetes and other complications that you might be HIV positive and maybe you are on medication. You need to talk to your doctor about any medication that you might be taking or any existing conditions. This will help your doctor to know how to handle your pregnancy, and this will help your baby not to be tampered with because of the medications that you are taking or because of your conditions, that the condition that you have. And it is also good for you because the doctor will be able to manage your conditions. So guys, thank you so much for watching this video, guys, and I believe that it will assist one of those people who are trying to conceive. And if you've not subscribed to my channel, please subscribe to my channel for this and more videos that are coming. So guys, thank you so much for watching.